This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops! Lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker and then I'll get back to it.
This episode is brought to you by Netflix. Jay Kelly, the new film from Academy Award nominee Noah Baumbach. George Clooney stars as an actor confronting his past and present on a journey of self-discovery, alongside Adam Sandler as his devoted manager. Critics are calling it a declaration of love to the chaotic art of filmmaking, with the Wall Street Journal praising it as a transcendent comedy drama. Jay Kelly is now playing only on Netflix.
Hi, my name is Alex Conway. I'm a fourth-year medical student at Kaiser School of Medicine, and these are pharmacology questions 1 through 3. Pharmacology question 1. A 24-year-old man is brought to the emergency department by his friends for altered mental status, vomiting, severely slowed breathing, and cold, clammy hands. On physical examination, he has a bluish tone to his lips and pinpoint pupils. When his family arrives in the emergency department, they mention that the patient has been abusing fentanyl for the past 6 months. Which of the following is the most appropriate treatment for this patient? A. Dextromethorphan. B. Flumazenil. C. Methadone. D. Naloxone. Or E. Naltrexone. The correct answer is D. Naloxone. Naloxone is a short-acting opioid antagonist, generally administered intravenously in cases of opioid overdose. If there is a delay in securing intravenous access, it may be administered nasally, subcutaneously, or intramuscularly. This patient is demonstrating evidence of an opioid overdose, given his history of fentanyl abuse, pinpoint pupils, and signs of cardiopulmonary depression. Since this patient has respiratory depression, pulse oximetry should be monitored, and the patient should be ventilated by bag valve mask attached to supplemental oxygen before and during naloxone administration to reduce the chance of acute respiratory depression. Answer choice A, dextromethorphan, is incorrect. Dextromethorphan is a mu-opioid agonist added to cough syrups in order to help suppress cough. It would not make the patient's symptoms better. In fact, it may exacerbate his cardiopulmonary depression. Answer choice B, flumazenil, is incorrect. Flumazenil is a GABA-A antagonist used in the treatment of benzodiazepine overdose. Answer choice C, methadone, is incorrect. Methadone is used in opioid detoxification and/or maintenance therapy. Answer choice E, naltrexone, is incorrect. Naltrexone is a long-acting opioid antagonist used to prevent relapse in patients once they have been detoxified from opioids. It would not be appropriate to use this agent in the acute setting of an opioid overdose. Key learning point. Naloxone is a short-acting opioid antagonist usually administered intravenously in cases of opioid overdose. Pharmacology question 2. A 19-year-old man is brought by his roommate to the emergency department for evaluation of confusion and disorganized behavior. The roommate states that he returned home from an afternoon outing to find the patient yelling about eagles flying around the room and trying to lift up his car. He is worried that the patient may have taken something. Past medical history is non-contributory. The patient is severely combative and uncoordinated in the exam room. Physical examination is significant for tachycardia, diaphoresis, ataxia, and vertical nystagmus. Which of the following describes the primary mechanism of action of the most likely substance taken by this patient? A. Allosteric activation of the GABA-A receptor. B. Antagonism of the NMDA receptor. C. Increased synaptic levels of serotonin. D. Partial agonism at nicotinic acetylcholine receptors. Or E. Partial agonism at mu-opioid receptors. The correct answer is B. Antagonism of the NMDA receptor. This patient likely ingested phencyclidine. or PCP, which is an NMDA receptor antagonist and dissociative anesthetic. PCP intoxication results in severe combativeness, sympathetic overactivity such as diaphoresis or tachycardia, disorganized behavior, ataxia, dissociation, perceived superhuman strength, and increased pain tolerance. Multidirectional nystagmus is a hallmark finding. Answer choice A, allosteric activation of the GABA A receptor, is incorrect. This is the mechanism by which benzodiazepines, barbiturates, and alcohol exert their effects. These substances are depressants and are unlikely to present with the sympathetic overactivity found in this patient. Answer choice C, increased synaptic levels of serotonin, is incorrect. This is a mechanism by which 3,4-methylene dioxymethamphetamine, MDMA, also known as ecstasy, exerts its effects. MDMA is a hallucinogenic stimulant which causes disinhibited euphoria, bruxism or teeth grinding, and increased sociability, empathy, and sexual desire. It can also cause life-threatening hyperthermia and/or hyponatremia. Answer choice D, partial agonism at nicotinic acetylcholine receptors, is incorrect. This describes the mechanism of varenicline, a cholinomimetic used for smoking cessation. Overuse of varenicline can result in nausea, insomnia, and vivid dreams. Answer choice E, partial agonism at mu-opioid receptors, is incorrect. This describes the mechanism of buprenorphine, which is a central nervous system depressant used to attenuate opioid withdrawal symptoms. Key learning point. Phencyclidine, or PCP, exerts its effects through NMDA receptor antagonism. Intoxication with PCP can present with severe combativeness, sympathetic overactivity, ataxia, and dissociation. Multidirectional nystagmus is a hallmark finding.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Pharmacology question 3. A 6-year-old boy presents with his father to the emergency department for excessive salivation, watery eyes, and uncontrolled defecation, which started suddenly 1 hour ago. The father states that he found his son playing in the medicine cabinet and worries that he may have consumed some of the father's pills. The father takes medications for hypertension and myasthenia gravis. The patient does not have any significant past medical history. The patient's vital signs reveal bradycardia, and physical examination reveals excessive salivation and watery eyes. Auscultation of the abdomen reveals growling and rumbling sounds, though there is no tenderness to palpation. Which of the following additional findings is most likely present in this patient? A, dilated pupils. B, dry skin. C, elevated blood pressure. D, elevated temperature. Or E, pinpoint pupils. The correct answer is E, pinpoint pupils. This patient is likely suffering from a cholinergic crisis secondary to consuming medication for myasthenia gravis, for example, the acetylcholinesterase agents such as pyridostigmine. Symptoms of a cholinergic crisis can be remembered by the mnemonic SLUDGE for salivation, lacrimation, urination, defecation, gastrointestinal upset, and emesis. The growling or rumbling sounds in the abdomen is called borborygmi. Excessive parasympathetic activity also results in pinpoint pupils and bradycardia. Answer choice A, dilated pupils, is incorrect. This would be a feature of a sympathomimetic crisis. The parasympathetic activity of a cholinergic crisis is more likely to yield pinpoint pupils, which can also be found in opiate overdose. Answer choice B, dry skin, is incorrect. This is more commonly a feature of an anticholinergic crisis, which is often remembered by the mnemonic hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter, to remember the symptoms of hyperthermia, mydriasis and blurred vision, dry skin and mucous membranes, flushing, and altered mental status, agitation, and paranoia. A cholinergic crisis, by contrast, causes excessive bodily secretions. Answer choice C, elevated blood pressure, is incorrect. This is more commonly a feature of a sympathomimetic crisis. This patient is more likely to experience excessive parasympathetic activity. Answer choice D, elevated temperature, is incorrect. Hyperthermia is more commonly a feature of an anticholinergic crisis, which is often remembered by the mnemonic hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. Key learning point. A cholinergic toxidrome is characterized by excessive salivation, lacrimation, urination, defecation, gastrointestinal activity, bradycardia, and pinpoint pupils. Cholinergic crises can result from overdose of acetylcholinesterase inhibitors, such as those used to treat myasthenia gravis.